Good afternoon, salute, and thank you very much for joining us today. This pandemic has presented everyone with challenges. However, the most critical is slowing the spread and saving lives. As we know, this is most important for seniors and those with pre-existing medical conditions, as they are at the greatest risk of severe health complications due to COVID-19. Unfortunately, we have seen many long-term care homes in Canada experiencing outbreaks of COVID-19, with some facilities reporting multiple deaths. This is heartbreaking. Residents of long-term care homes are vulnerable to infections due to their communal living spaces, shared healthcare providers, exposure to external visitors, and transfers from other healthcare facilities. The Government of Canada has released evidence-informed guidelines to help residents, seniors, and healthcare workers in long-term care reduce the spread of the virus, remain safe and healthy. Officials at the Public Health Agency of Canada developed these guidelines in close consultation with their provincial and territorial partners. La ligne directrice aidera les résidents et les travailleurs.
This work builds on previous guidance in Canada and is informed on lessons learned by other countries.
On previous guidance in Canada and is informed by lessons learned in other countries, as well as interim guidance from other Canadian and international bodies. Long-term care homes are under the provincial and territorial jurisdiction. However, the guidance provides recommendations that complement provincial and territorial efforts to monitor, prevent, and control healthcare-associated infections. These guidelines may be adapted to other settings, such as retirement homes and residential homes for those with developmental disabilities. The key recommendations include measures such as restricting visitors and volunteers to only those deemed essential for basic medical or compassionate resident care, screenings before every staff shift or essential visitor entry and daily for residents, ensuring staff do not report to work with symptoms, and if they develop symptoms at work, are tested and excluded from work, requiring staff, essential volunteers and visitors wear a mask during the duration of their shift or visit, providing training on infection control measures such as proper hand hygiene and use of personal protective equipment, routine additional cleaning, especially for high-touch, high-risk surfaces. Wherever possible, limiting work for employees to a single facility and limiting the number of locations in the facility in which employees work. And like all Canadians, practicing physical distancing to the greatest extent possible, including during mealtimes. That includes canceling non-essential outings. Many facilities have already implemented several of these measures, and for those, I applaud them for their vigilance and efforts to protect the most vulnerable among us. Providing consistent guidance for long-term care homes across the country will help save lives. And that's by protecting those seniors and those dedicated to caring for them. Assurer une guidance constante auprès des établissements de soins.
Providing consistent guidance for long-term care homes across the country will save lives.
However, it will take much more than these guidelines to keep our seniors and vulnerable Canadians safe. It would not be possible to keep them safe without individual Canadians practicing social distancing. We recognize that involves difficult decisions and personal sacrifices. It is essential that individuals practice social distancing to keep everyone safe. I want to acknowledge the role that Canadians all across the country are playing in flattening the curve and helping us all get through this. Most of all, I want to recognize all the caregivers and outstanding public health workers who are doing an exceptional job of providing essential service and who are working tirelessly in our communities in very difficult circumstances. We all need to do our part to help stop the spread of the virus among the residents of long-term care homes, as well as the workers who care for them. Together, we'll get through this. Thank you.